For more than 30 years, Capital Spine and Pain Centers has served Virginia and Washington, D.C. with quality care in the diagnosis and treatment of musculoskeletal injuries and pain. With board-certified physicians among the most talented pain specialists in the country, the practice continually implements the latest therapeutic breakthroughs, including regenerative injection therapies such as Platelet Rich Plasma Treatments.
The mission of Capital Spine and Pain Centers is to relieve people's pain, to restore their function, and help them reclaim their lives, which may have been totally altered because of their pain problem.
We've been very successful at taking a group of physicians with very diverse skills and techniques. Each of those physicians has a different knowledge base and experience and expertise. And that's the whole plan, to take a group of people and physicians and take their own board certifications and be able to diversify the care for each of the patients to ensure the best outcome possible.
We use the latest advances in both diagnosis and in treatment and bring those to bear on the patient's problem, thereby allowing them the greatest opportunity to improve their quality of life and get back to what they think is important. We offer a whole range of very top-flight interventional techniques such as discography, epidural blocks, radiofrequency denervation, vertebroplasty, neuromodulation, spinal cord stimulation, things that are at the very cutting edge of treating people's pain.
We are a society on the go, and whether it's brought on by exercising, working, or simply keeping pace with our hectic lives, millions of us live every day with some type of acute and chronic pain. For years, surgery was thought to be the primary answer for the treatment of persistent pain. But now, innovative breakthrough therapies are opening up a whole new direction of treating and caring for injuries.
We're finding the operations are becoming smaller and smaller, more minimally invasive, and done under microscopes rather than open surgeries. Likewise, we're finding a lot of the conditions that used to be treated surgically are now treated with non-surgical techniques. We can guide needles deep inside the body and deliver healing medication and treat problems that we find without opening the patient up.
Dr. Friedlis and his multidisciplinary team practice here at Capital Spine and Pain Centers in Virginia and Washington, D.C. These pain specialists integrate precision diagnostics, sophisticated techniques, and innovative therapies in a comprehensive plan customized to resolve a patient's pain and help them live life to the fullest.
A patient's chronic pain is often a combination of multiple diagnoses. You may have an injured ligament, tendon, and joint. And ultimately, the treatment for each of those may be slightly different. So we often take a combination of treatments and combine those treatments together in order to ensure that we maximize the healing of those tissues.
This is one of the groundbreaking new treatments offered by Capital Spine and Pain Centers, Platelet Rich Plasma, or PRP therapy, a revolutionary treatment that relieves pain by promoting long-lasting healing of musculoskeletal conditions. This rapidly emerging technique is showing exciting potential in the treatment of osteoarthritis.
Platelets, which are cells which circulate in your body, are taken from the body through a special process. It's administered right here in the office. It's a simple outpatient procedure. We start by drawing your blood, just like if you went to the lab. The blood is then taken and put in a special machine that separates and concentrates the platelets. And then we take those platelets and we inject them right into the site of the injury. It leaves you a little sore for a couple of days, and then those platelets go on and start healing you. The treatment is extremely useful for things like rotator cuff injuries, for whiplash injuries, for back strains, for osteoarthritis of the knee or the hip, Achilles tendonitis, plantar fasciitis. Anytime you have failure of a ligament, a tendon, or a joint structure, this is an extremely helpful treatment. About 80% of the people we do this on get a good or exceedingly good response, many of them cured. We're able to actually stimulate some growth and repair in those structures and heal them to such a degree that the patient is pain-free and continues to be pain-free into the future.
All of these procedures are performed safely in this medical office without general anesthesia or hospital stays.
Tore the labrum in my shoulder, so I consulted capital spine and pain centers. Saw Dr. Friedlis. He said I was a candidate for platelet rich plasma. I had one PRP therapy session. I was back in the gym within 3 months, fully functional.
This changes the whole way we look at pain. Now we have a whole new concept where we can actually enlist the body's own healing potentials, its own healing powers to actually heal itself. And by directing and turning on the body, we can make this happen. So through the use of platelet-rich plasma, the platelets are turning on a whole system in the body to make it heal. It's attracting special cells to make new blood vessels grow. It's attracting special cells to make new cartilage grow, to make new tendon grow, and that reconstructs and repairs the actual injury that has occurred.
Understanding the physical, psychological, and emotional toll pain can have on a person's life, Capital Spine and Pain Centers personalize their care to each patient's unique case, customizing a treatment plan to deliver the best possible outcome.
We really need to take the time to listen to the patient and help them to decide what are the best options for them. One way we help to educate them is to use our website, which has animations and videos and written material for patients to better explain those treatments. And by doing so, it helps them really feel comfortable with the options that they choose. We may have our own opinions as well about how we should go about treating the patient in order to ensure the best success, but you really need to make sure that matches up with the patient and their ideas about their own care.
It wasn't until I had PRP therapy at Capital Spine and Pain Centers that everything stabilized, strengthened, and the pain in my leg and hip finally went away.
Level of care I received from Dr. Friedlis and his staff was excellent. He put me at ease from the very beginning, walked me through the entire process, was with me throughout the follow-up. I can't think of a more accessible provider I've ever dealt with.
I feel absolutely wonderful. I'm back to working out. It doesn't hurt to sit in the car and drive. I'm pain-free. I don't wake up at night anymore. And the care that I got at Capital Spine and Pain Centers was absolutely top-notch. Fantastic.
Well, in the last 30 years, we've grown from just 2 doctors in 1 office to 17 physicians in 8 offices. We seem to be doing a good job because one of the confirmations to us that we get on a daily basis is that patients will send their friends and family to us.
We're able to combine their goals with the treatment options that we have, which are innovative, and put those together to really help them reach the goal that they want, which is to have a normal life, as everyone does. And to be able to help someone to reach that point is incredibly gratifying.
When you come to Capital Spine and Pain Centers, you know you're coming to the right place. We treat your pain seriously.
It's time to get back to living pain-free. Learn more today about Capital Spine and Pain Centers. Relieve your pain, restore and reclaim your life. For more information, visit treatingpain.com or call the number on your screen.